Hello, my name is Maggie Griffith, and this is my capstone video reflection for Assessment 5. I had the opportunity to present my capstone project of an educational in-service PowerPoint for healthcare professionals to my group participants and received feedback from them. Most of the feedback I received continued to echo the sentiments that I had read in the literature regarding the problem of a lack of conversation and education around formula usage as a newborn feeding option. One of my participants shared a stark summary stating that, quote, "I feel like the main takeaway is how much we are failing new moms during such a vulnerable time." That participant earlier in the project had shared several negative experiences surrounding newborn feeding that she experienced with both of her children. I could draw a comparison between her experiences and the study results from Blixit et al. In the International Breastfeeding Journal that showed that oftentimes women who had just given birth were dissatisfied with the care they received regarding discussions about breastfeeding for reasons such as being given generalized advice instead of individualized, being spoken to in a disrespectful or judgmental way about newborn feeding options, being given too much or unwanted advice, or not giving practical information, and being asked questions in a close-ended way that did not invite the participation of the mother. Another participant saw more of a middle ground, trying to be accomplished with my capstone project, stating that, quote, "I agree that mothers need to be told about the benefits of breastfeeding, but also told that formula is available and it doesn't mean you are failing." This could be seen as aligning with Lewis in her case study, an article that I had referenced throughout the capstone project entitled "Breastfeeding Friendly but Not Formula Averse." Lewis makes the argument that although breastfeeding will always remain the optimal route for term infant nutrition, formula supplementation is a reasonable alternative when breastfeeding difficulties arise. My capstone project, similar to Lewis's findings, indicate that additional research and new guidelines are called on to help improve the problem. The feedback that I received from my project had a common theme that it enhanced the participants' experiences by allowing them to feel seen, heard, and acknowledged regarding a problem that had caused them anywhere from mild to significant feelings of depression and/or anxiety in the early days of their child's life. They expressed in various ways that they were glad someone in the medical field was calling attention to the problem and that it validated their thoughts that improvement is needed in the area of newborn feeding conversations. In regards to using evidence-based and peer-reviewed literature to plan my capstone project, I was initially concerned that there wouldn't be enough to go off of because the Baby Friendly Hospital Initiative and its structure and goals is still considered the current gold standard by most in the healthcare community. I was surprised and encouraged to find just how much evidence-based and peer-reviewed literature there was already in studying and discussing the issues surrounding formula feeding. I kept a master list of all my resources used during this course, and at the end, out of 34 resources used, 19 of them involve the topics of breastfeeding difficulties, lack of information or support around formula usage, stigma of formula use, postpartum and anxiety and depression linked to newborn feeding issues, readmission rates for exclusively breastfed newborns versus those who had been given formula, and trials of support systems for formula feeding mothers. So I knew at that point that I had a strong case for the development of my capstone project based on the amount of evidence-based information, that this wasn't just something that myself and other new mothers had an emotional response to or that I had witnessed when I worked as a labor and delivery nurse, but that there was peer-reviewed research done that confirmed changes needed to be made regarding how our current healthcare system addresses newborn feeding. Choosing to do my project as an in-service targeted at healthcare professionals was based on the central theme from the literature that I found that education for those who care for mothers and babies is a critical component to improving the problem. Diaz-Sempro et al. In the clinical implications of their study had stated, quote, "Healthcare providers, including nurses, have a responsibility to regularly update their skills and knowledge and incorporate the most recent evidence-based best practices. and that it is important for these healthcare providers to acknowledge that research has shown that difficulties in breastfeeding are not uncommon, and that failure to meet breastfeeding intentions correlates with increased postpartum depression and anxiety. Diaz-Sempro et al. Goes on to say that for healthcare providers, quote, educating women on safe formula feeding represents an opportunity to protect the health and well-being of infants who might otherwise suffer as a result of potentially poor practices by well-meaning mothers. With the results from their study and many more, I knew that my focus for this capstone project would need to be on educating healthcare professionals about the problem and about possible solutions. I utilized healthcare technology in my capstone project by proposing the use of an app similar to the Growing Healthy app that was trialed in Australia. With many parents acknowledging the need for continued support with newborn feeding after leaving the hospital, but finding that face-to-face encounters weren't always practical or accessible, an app like Growing Healthy that provides evidence-based best practices for nursing and formula feeding was an appropriate solution in allowing for reliably, medically sound, and on-demand support and education. It was reported in the study by Tang et al. That mothers who used the app had an increased sense of confidence in their feeding decisions for both formula and breastfeeding. Unfortunately, when I went into the Google Play Store now, I cannot find the Growing Healthy app is currently available for download. There are many other apps I found that offer a variety of newborn feeding and support and tracking. However, I was unable to find any that were created by reputable professional medical organizations. So it remains questionable what the sources of information are for the current for-profit newborn feeding apps that exist, which makes it difficult for a healthcare provider to make a sound recommendation for mothers of what to use currently. There is definitely room for nurses, possibly those in informatics, doctors, or organizations such as the American Academy of Pediatrics to help with the development and design of a smartphone app that parents can reliably use to help support their newborn feeding. For health policy that influenced the planning and implementation of my capstone project, I had quite frequently acknowledged that Baby Friendly USA and the Baby Friendly Hospital Initiative were the long-standing governing bodies for hospitals to receive that accreditation. And throughout all of these assignments and culminating in my capstone, voiced the concerns with their policies that were raised by the literature. I had included in my PowerPoint presentation several quotes from a variety of peer-reviewed sources that expressed a need for change to these current policies, and I felt that Appleton et al. Had succinctly summarized the need for those changes, stating that, quote, recent research in this area has called for feeding support that is more individual to feeding style, empathetic to parents' choices, family-centered, and specifically provides support for formula feeding. This project in educating healthcare professionals about the shortcomings of the Baby Friendly Hospital Initiative could be seen as contributing to the development of new policies that allow for a more holistic approach to newborn feeding conversations that is being called for by the research. As a baccalaureate prepared nurse who has now left the bedside and is in a place of being involved with the care coordination for 2 hospitals that serves mothers and babies, I can see where I have a greater responsibility to educate providers now that I have completed thorough and unbiased research with the identification of a quality of care issue, and doing so on a more advanced level than I could have with only my nursing diploma that I had previously. In discussing the outcomes of my capstone project, most of my expectations were met. I was hesitant going into this project, as I had mentioned before, because I knew the notion of discussing anything other than the standard of solely promoting exclusive breastfeeding could be seen as controversial and was challenging the current majority consensus of best practices. Hearing the initial feedback from my group participants, as well as their continued input through the assignments, was encouraging. The creation of an evidence-based PowerPoint presentation that was a sound source of knowledge for healthcare professionals to be able to recognize the problem, as well as potential ways they can start to redefine care at the bedside and beyond, was a gratifying finish to this course. This intervention could potentially be presented and considered for adoption within my healthcare network, but would obviously need to go up the chain of command in several places before that could be considered. The fact that both of the hospitals in my network are currently accredited as baby friendly could potentially have an issue with the risk that the attitudes and suggested interventions could be seen as a threat to their accreditation. This in-service would be presented at current non-accredited hospitals that may have more freedom and flexibility to determine their own best practices. One aspect that fell short of my expectation was the response timing of participants. While there was initially a quick offering to volunteer and input being provided from participants, as the project went on, it did become more difficult to engage participants in conversations and receive timely feedback. I think this was largely due to the limitations of not having designated face-to-face encounter times, as well as the fact that most participants do still have young children and are balancing working from home and homeschooling in their families due to the pandemic. So at times it felt like their participation was viewed by them as one more additional responsibility during a hectic time. Lastly, in discussing my personal and professional growth throughout both the Capstone Project and my RN to BSN journey, I feel a deep sense of accomplishment and pride. I enrolled in the Capella program last February. My first class started on March 9th of 2020. 4 days later, the world essentially shut down and everything changed. Had I not already enrolled in the program, I probably would not have set out to pursue more education in the midst of a global pandemic. However, the fact that I was able to continue progressing through the program during such a challenging time made me feel more confident and empowered that I could complete this program and that I could continue to grow as a baccalaureate prepared nurse. As fall came and I had enrolled in 2 courses at the same time, one being my capstone course, my work schedule and childcare schedule again changed, and I found myself unable to keep up with the workload and deadlines despite my best attempts to make adjustments. But even then, looking back on that part of this, my time with Capella, I can see a real area of personal growth in that I was able to work with my coach and withdraw temporarily from the Capstone Project instead of just giving up altogether when things seemed overwhelming, which I actually had done the first time I attempted to get my BSN nearly 5 years ago. Re-enrolling in the Capstone Project 2 months later allowed me to pick up where I left off and with a feeling of renewed purpose and energy to tackle the remaining assignments. And as noted, at the beginning of my Capstone Project, I had a passion to address the problem of newborn feeding issues around formula use, but I was uncertain of if I could address all the different components in the first 3 assignments and be able to contribute to a solution with assignment 4. However, when I look now through my PowerPoint presentation and the feedback from my group participants, I leave the program much more confident in my skills of research, of innovative thinking, setting and meeting deadlines, adjusting and adapting to change, and problem solving. So I look forward to continuing to strengthen and use these skills as I progress in the realm now of a nurse care coordinator. Thank you for your time and your support.